Hey there, today I am here for anyone who wants to know about pain during your periods. So maybe you are a parent of a female or you have periods yourself. I'm going to present a tool that will open up your pain relief toolkit. So cramping in the lower abdomen that occurs just before your menstruation is called primary dysmenorrhea, and as many as 90% of females experience this at some point throughout their life, with the vast majority of them experiencing it in their teen years. Now, I personally experienced debilitating menstrual cramps with the onset of my period nearly every single month. The doctors insisted everything looked normal and just to keep on taking OTC pain meds and possibly later in life get on birth control to get through it. Now, it was so frustrating at the time, and it caused me to miss a lot of work, many activities, and also caused a ton of anxiety in my life. I lived in constant fear of my periods, and those who have experienced this type of pain know that it's not an exaggeration when I say that. It literally took over my life. Now, if you know someone who is in this phase of life and things check out medically, meaning that there isn't anything deeper going on, listen up here because this video could provide a great non-pharmacological therapy to ease that pain, which can also lift the anxiety and uncertainty of those days leading into your next period. So the aim of this study was to assess the effectiveness of blended essential oils on menstrual cramps for outpatients with primary dysmenorrhea. Remember, that's that lower abdominal pain and cramping leading into your menstruation. And they also wanted to explore what the analgesic ingredients were in the essential oils to find out why they worked so well. Now, if you're wondering, analgesic is just a medical term for the pain relief components, and that's going to be in the essential oils. So this study was randomized, it was double-blinded, and that's what they consider the gold standard for clinical trials. That means both the participants and the people conducting the trial don't know who is in which group, so there can't be any bias going on about the results when it comes to following up with them. So 48 patients participated in this study. They all had dysmenorrhea that was verified by a gynecologist. All of them rated their pain between 5 and 10 on a 10-point scale, meaning that their pain was moderate to severe. The patients were randomly assigned to an essential oil group or a synthetic fragrance group. The essential oils or the synthetic fragrance were lavender, clary sage, and marjoram in a 2:1:1 ratio. So the essential oil was diluted into an unscented cream at a 3% concentration, and the fragrance oils were also blended into cream to make them both smell the same. All outpatients used the cream daily to massage into their lower abdomens from the end of last menstruation, continuing to the beginning of the next menstruation. Now the results here, are you ready? The duration of pain was significantly reduced from 2.4 days to 1.8 days after aromatherapy, that's the essential oil intervention, in the essential oil group after just 1 month of applying this cream to their abdomens for one menstrual cycle. They were actually able to scientifically prove that you can shorten the duration of pain with an essential oil blend. What they found when they took a closer look at these essential oils was that the blended oils contained 4 key analgesic components to comprise as much as 79% of the essential oil blend. All of them are naturally occurring compounds in the plants. So you literally are using the goodness of the plants, applying them to your body and getting all the benefit. So this study suggests that the blended formula can serve as an alternative or as a complementary agent for the treatment of primary dysmenorrhea. Well, it is wonderful to see these types of natural alternatives being explored because over-the-counter pain medications come with a list of side effects, even for occasional use, but especially for long-term use. I know that I would rather avoid all that drama with liver and kidney complications and try the natural essential oils before reaching for that bottle of pain medication. Remember that I am here to serve you, to continue to bring you scientific evidence for using natural alternatives, and to help you get the absolute best deal on amazing essential oils that I use for myself, for my family, and the ones that we really believe in. Now, if you liked this video and you found it helpful, could you please do me a favor, give it a like, comment with one thing that you learned. I would be extra appreciative too if you shared it to your story or tag a friend who could benefit from this information as well. Thank you, and I will see you in the next video.